you, Mr. Chairman, and thank you to our witnesses as well. The chart that we saw earlier is very interesting, and certainly it's enlightening in terms of the trends that they indicate. I'm sure you saw the chart as well. Mr. Book, now the cuts would take place in 2015. Is that correct?
Well, we already have published rates for 2015 that incorporate those cuts. Yes, we have not. You know, the rates are published. The specific rates are published 1 year at a time. So we've seen the first year of cuts already. So
are we going to see some trends, some different trends from the lines in this graph?
I believe so. Yes. In fact, you know, as my colleague mentioned, they're already withdrawing from one geographic area, and that's one plan sponsor withdrawing from one area. I think we're going to see more withdrawals and more increases in premiums. Again, this year the change from last year is only 3%, but that's because the Affordable Care Act's cuts for last year were offset by regulatory action. So the transition from 2014 to 2015 is going to be less than it would have been, you know, before. Once you start moving forward, we're going to see, you know, substantial changes unless there's some other action, you know, if that causes the Affordable Care Act not to be implemented.
Okay. Mr. Baker, do you believe that these trends can continue with the impending changes?
Well, certainly recent projections by the CBO continue to indicate that there will be rising enrollment in Medicare Advantage, and that the initial projections are and the CBO took into account these changes in reimbursement methodology, that there will continue to be different projections, better projections about ongoing enrollment in Medicare Advantage. So it does look like plans will be able to absorb these cuts. They will be able to innovate around and be
For how long do you think they can absorb and just kind of continue amidst many of these conditions? I mean, my concern is overall that healthcare professionals are frustrated. They don't like the view of the future. It concerns me greatly, especially as a representative of a part of rural America, that healthcare providers, when I hear from them, they're discouraging they're discouraging young people, especially family members, from going into healthcare, and this is because of the federal government making such a bureaucracy of healthcare. And I'm very concerned that such a reduction in providers, it's already difficult to find providers in rural America, and it stands to get much worse. And lack of providers means less competition in urban areas and less mere access in rural areas. And we see that there might be, there will likely be disproportionate impact to Medicare Advantage choices in rural America. Mr. Book, can you elaborate on that? Perhaps is it correct that there would be a disproportionate reduction of choices in rural America?
I haven't looked specifically at the rural-urban distinction, but if you want, I can get back to you on that later. In general, plans that have some of the rural counties had adjustments, had upwards adjustments in their benchmarks prior to the ACA. That indicates they might be hit harder, but I would have to check the numbers to be sure. Okay,
I would appreciate any further information on that.
I can do that, yes.
I'm very concerned about the frustration that this is causing across healthcare, and that this would actually lead to.
There is an extra bonus in the Affordable Care Act for certain types of urban areas, but not. And it's there's a set of demographic criteria for what counts as a qualifying county. It doesn't include every urban area, but it doesn't include any rural area. So it's you know, again, I'd have to look at numbers to be sure, but I would not be surprised if it turns out that rural areas are harder hit.
Okay. And thank you, Mr. Chairman. I yield back.
Thank you.